Hello and welcome back to Body Drive. Today, we're going to talk about testosterone myths that the medical industry doesn't want you to know about. Testosterone is a hormone that plays a critical role in men's health. It affects everything from muscle mass and bone density to sex drive and mood. As men age, their testosterone levels naturally decline, which can lead to a host of health problems. But there are a lot of misconceptions about testosterone that are perpetuated by the medical industry. Today, we're going to debunk some of those myths and give you the facts. Myth number 1. Testosterone replacement therapy is dangerous. This is one of the biggest myths out there about testosterone. Yes, there are risks associated with testosterone replacement therapy, but these risks are minimal when the therapy is prescribed and monitored by a qualified medical professional. In fact, testosterone replacement therapy can be incredibly beneficial for men who are experiencing symptoms of low testosterone, such as fatigue, decreased sex drive, and muscle weakness. It can also help to reduce the risk of heart disease and other health problems. However, it is important to note that testosterone replacement therapy is not appropriate for all men. It is typically recommended for men who have low testosterone levels and who are experiencing symptoms related to low testosterone. It is not recommended for men who have normal testosterone levels or who are trying to boost their testosterone levels for non-medical reasons. Myth number 2. Testosterone causes prostate cancer. This is another myth that has been perpetuated for years, but it simply isn't true. There is no evidence to suggest that testosterone causes prostate cancer. In fact, some studies have suggested that low testosterone levels may actually increase the risk of prostate cancer. If you're concerned about your prostate health, it's important to have regular checkups with your doctor and to get screened for prostate cancer. Your doctor can help you determine the best course of action based on your individual health needs. Myth number 3. Testosterone is only important for sexual function. While testosterone does play a critical role in sexual function, it's important for so much more than that. Testosterone affects everything from muscle mass and bone density to mood and cognitive function. Low testosterone levels can lead to a host of health problems, including fatigue, decreased muscle mass and bone density, and depression. It's important to maintain healthy testosterone levels throughout your life to ensure optimal health and well-being. In addition to the physical benefits of healthy testosterone levels, there are also psychological benefits. Studies have shown that men with higher testosterone levels tend to have better self-esteem, higher energy levels, and better cognitive function. Myth number 4. Testosterone therapy is only for older men. While it's true that testosterone levels naturally decline as men age, low testosterone can affect men of all ages. In fact, some men may experience symptoms of low testosterone as early as their 20s or 30s. If you're experiencing symptoms of low testosterone, such as fatigue, decreased sex drive, and muscle weakness, it's important to talk to your doctor. Your doctor can test your testosterone levels and recommend appropriate treatment. Myth number 5. Testosterone therapy causes heart disease. This myth has been around for decades, but there is little evidence to support it. In fact, some studies have shown that testosterone replacement therapy can actually reduce the risk of heart disease in men with low testosterone levels. However, it's important to note that testosterone therapy is not appropriate for men who have a history of heart disease or who are at high risk for developing heart disease. Your doctor can help you determine if testosterone therapy is safe and appropriate for you. Myth number 6. Testosterone therapy is addictive. There is a common misconception that testosterone therapy is addictive, but this simply isn't true. Testosterone therapy is a medical treatment that is prescribed to men who have low testosterone levels, and it is not addictive in any way. While it is true that testosterone therapy can produce some positive effects such as increased energy levels, improved mood, and increased sex drive, it is not a substance that can lead to addiction. The reason for this is that testosterone replacement therapy is typically prescribed for a limited period of time to help men restore healthy testosterone levels. Once testosterone levels have been normalized, treatment can be discontinued without any adverse effects. In fact, it is important for men who have low testosterone levels to undergo testosterone replacement therapy, as it can help to improve their overall health and well-being. Testosterone deficiency can lead to a wide range of symptoms such as fatigue, decreased muscle mass, and reduced bone density. By restoring healthy testosterone levels, men can enjoy improved energy levels, increased muscle mass, and stronger bones. Myth number 7. Testosterone therapy causes mood swings. Another common myth about testosterone therapy is that it can cause mood swings. While it is true that some men may experience mood changes when they first start testosterone therapy, these changes are typically temporary and go away as the body adjusts to the therapy. In fact, many men report feeling happier and more energetic after starting testosterone therapy. This is because testosterone plays a key role in regulating mood, energy levels, and overall well-being. By restoring healthy testosterone levels, men can experience improved mood, increased energy levels, and reduced symptoms of depression and anxiety. It's important to note that any mood changes that occur during testosterone therapy should be discussed with your doctor. Your doctor can help you determine if the changes are related to the therapy or if there may be other factors involved. Additionally, your doctor can help you adjust your dosage or switch to a different form of testosterone therapy if necessary. Testosterone therapy is not addictive and does not cause mood swings. It is a safe and effective treatment for men who have low testosterone levels and can help to improve overall health and well-being. If you are experiencing symptoms of low testosterone, it's important to talk to your doctor and explore your treatment options. Thanks for watching, and be sure to hit that subscribe button for the best tips and advice on how to enhance your body drive.